Okay, so welcome to our debate. Our topic is the right to exercise personal liberties versus the need for rehabilitation. Um, just to go through who's going to be presenting what. I'm the moderator, Emily. Our pro stater is Taj. The constater is also me. And then our pro prover is Rachel. Con prover is Harmony, and pro attacker is Taj. Con attacker is Carly, and pro stater is Taj. And then again, con stater is me. So to start off, our intro, as behavior analysts, we make choices on behalf of our clients every day. It affects their current lives, their future lives. We decide literally all of what they have access to while they're in our care, what food they have, what reinforcers they have access to, what treatment they're a part of. And I think the overall goal for all of us is the well-being and quality of life for our learners. So the right to habilitation is defined as the right to help people gain new skills, abilities, and knowledge. And liberty is defined as the power to act as one pleases. So our debate will focus on the pros and cons of clients having the ability to choose or not choose to participate in treatment.
Okay, hello everyone. My name is Taj and I am the pro stater. I am mostly here to advocate for the enhanced autonomy and personal freedom of clients within ABA settings. My side mainly centers around the profound benefits and ethical imperatives of granting clients the freedom to make choices and have a say in their treatment. Denying individuals their personal freedoms not only contradicts their autonomy but also hinders their ability to control their own lives. Instead, granting them these freedoms motivates clients to engage more enthusiastically and actively in their therapy, as they have a say so in their treatment objectives and goals. Compassionate care thrives when clients' personal freedoms are respected. Tailoring treatments to fit individual needs, wants, and beliefs leads to more effective outcomes. Moreover, this respect boosts clients' general welfare and quality of life, making them feel accepted and appreciated. Upholding clients' rights to their personal liberties align seamlessly with ethical standards in the field of ABA. This practice promotes dignity, respect, and strengthens trust between the practitioner and the client, fostering a positive working relationship. Finally, empowering clients to exercise their personal freedoms enables them to take control of their lives and make decisions that best deserves their interests. By respecting and promoting individual freedoms, we pave the way for more effective, ethical, and compassionate care. In conclusion, granting clients enhanced autonomy and personal freedoms is not merely an ethical obligation, but a pathway to more effective, compassionate, empowering ABA practices. It is essential for improving motivation, quality of life, trust, and overall treatment outcomes. Let us stand together in support of respecting and promoting the autonomy of those we serve. Thank you.
Okay, so as the con stater, our point basically is clients shouldn't be able to choose if they participate in treatment because there's a multitude of complications that can follow that. So clients may resist teaching or treatment if they're given the choice. Like I know so many of my learners that I have right now, if I could allow them to escape treatment or running trials, they would. So if they're allowed to do that, they may be unable to meet unable to meet documented goals and objectives, which can have further implications like being discharged from the program, or maybe the district will, like at my current job, the district would stop paying for them to be a part of our program. Um, so if clients make unfavorable choices to not participate, it can also potentially increase or they could engage in more problem behavior, which can fall into the issue of do no harm. And there's so much potential for harm in that case, like SIB, aggression, property destruction, elopement, disruption. I know some of my learners, the minute they're able to like have a moment where they're not working, as they immediately engage in um, unsafe behavior, which puts the client's safety at risk, and that also puts the staff's safety at risk. And everybody's safety is obviously the priority here. Um, so continuous problem behavior can create issues for everybody involved. And it also hinders the promotion of independence by allowing escape, basically, just because they're allowed to choose whether they're in treatment or not doesn't mean they're learning how to um, like decide for themselves. And the population also gets federal financial support and receives funding. So going against liberties is kind of seen as a fair trade-off given the amount of money that's being given federally. And just some examples, if a client chooses a preferred task over learning how to dress themselves independently, the implications of that obviously are the child isn't learning how to dress themselves, and that can create so many issues down the line. Or another example, if a client chooses to avoid functional communication training, um, they may be unable to cooperate with the demands of school, work, society, which obviously affects everything. Um, and then, so this is a little map that shows how much each state spends federally in financial support. So I'm from New Jersey, so my state of New Jersey spends $2 billion in federal support for this population. Um, and then here it shows how the money is split up, so among the United States. So the money is there for those that need it. So like I said earlier, being sort of forced into treatment, it's kind of a fair trade-off when there is that financial support to back you up.
So choice in therapy goes farther than choosing whether or not to participate. Vivarkan et al. States that choices may function as a reinforcer and is an effective intervention to decrease challenging behaviors. Choice can be a powerful tool in practice, both as a meaningful outcome and important teaching tool. They go on to discuss that this can be choice in the instructional method, whether that's choosing what character is on their token board, or if we're targeting board games, choosing which board game they would like to play that time. It can also be utilized when choosing locations of a community outing. Maybe you're targeting going to lunch in the community. The patient can choose between going to Chick-fil-A or McDonald's. It could also be utilized when choosing the activities to play during recess. Maybe they have to interact with a peer, but they can choose whether they want to play on the play with a peer or play tag with a peer. Bannerman et al. States personal liberties can be compromised in many ways by service providers striving to meet standards for rehabilitation, be cost effective, satisfy parents, board members, school administrators, neighbors, or other consumers. They go on to discuss that this can lead to a loss of motivation to achieve goals because the clients have little or no input in decisions. It can cause choice making not to be taught. Making choices is a fundamental skill for making responsible choices in life that can affect the patient's overall quality of life. Providers limiting opportunities for patients to make choices by choosing inflexible schedules, limiting breaks, or restricting access to preferred items or activities goes directly against our ethical principles. In the BCBA Ethics Guide, the core principle number 2, treat others with compassion, dignity, and respect. Behavior analysts behave towards others with compassion, dignity, and respect by respecting and actively promoting client self-determination in the best of their ability, particularly when providing services to vulnerable populations. Acknowledging that personal choice in service delivery is important by providing clients and stakeholders with needed information to make informed choices about services. It can also directly be tied to Ethics Codes 201, providing effective treatment. If restricting choice in therapy makes patients have higher challenging behavior or lose motivation to achieve their goals, it violates this standard because it states that behavior analysts prioritize clients' rights and needs in service delivery. It also goes against Code 301, responsibility to clients, which states behavior analysts to act in the best interest of their clients, taking appropriate steps to support clients' rights, maximizing their benefits, and doing no harm.
Allowing clients to uphold control over treatment null and voids two specific ethic codes. The first code is providing efficient treatment. If the client is able to opt out of any program or exercise because they just don't want to do it, the treatment is no longer effective as there's no positive progress being made. The second violated is responsibility to clients. Allowing a client to make the decisions and engage in whatever they would likely lead to indulging in target behaviors that could escalate, causing harm to others or the client themselves. A part of responsibility to clients is to act towards what is best for the client and to do no harm. If a client can engage in dangerous behavior, then it is not in their best interest. If treatment is not productive, it causes financial loss for those involved. For example, directly affects the families or wasting government funding. The quote above, a common burden is that there is not enough healthcare available for their child with ASD, comes from a study taken where the practitioners interviewed parents with children diagnosed with ASD and their difficulties. With the limited access to treatment, it does not only hurt the ones that are in the program if their treatment is ineffective, but is also harming others that are unable to receive treatment as clinicians' times are filled with this non-effective treatment. In addition, it is best to utilize government funding properly before it is denied for renewal. Treatment that is not effective is damaged and must be repaired. Above are two quotes from an article playing devil's advocate on clients' rights. The first quote references how it is a large divider of service providers on how much of these liberties, such as making choices on treatment, is in the best interest of the client. However, later on in the article, it mentions that the easiest choices are the laziest choices. As adults, we wouldn't work 40 plus hours if we didn't have to pay rent. If you love what you're doing, you still have to work every so often. Who's to say that clients wouldn't avoid doing work because it's the easiest option? The second quote references that clients may not have the skill or understand the consequences of their choices and should be properly taught before they are allowed to make these decisions. For example, any child making their lunch without any supervision might have made a masterpiece in their mind, but the first bite could taste awful, ruining the whole meal. Without the proper training or education, decisions could be made incorrectly without realization, and the end results could cause anger, disappointment, and/or confusion. Choices aren't properly made if the situation cannot be properly assessed.
Okay, So let's address the argument that clients should not have the choice to participate in their treatment, a stance taken by some due to perceived complications. While ensuring effective treatment is important, this argument has very notable weaknesses. First, denying clients the right to choose undermines their autonomy and dignity. Forced compliance often leads to greater resistance and resentment, hindering therapeutic progress. Second, the fear that clients might exhibit problem behaviors if given a choice is based on worst case scenarios. Involving clients in decision making can actually reduce such behaviors by increasing their sense of control and cooperation. Ethical guidelines emphasize do no harm, which includes respecting clients' autonomy. Safety concerns must be addressed through careful case by case risk benefit analysis. Assuming all clients who opt out of treatment pose a safety risk is an overgeneralization. True independence is about making choices and learning from them. Denying clients this opportunity impedes their development of independent living skills. Regarding financial concerns, it is crucial to use resources in a way that respects clients' rights. Forcing treatment participation is not justified by public spending figures alone. Lastly, individualized treatment plans are essential. Effective therapy should be adaptable and responsive to each client's preferences and needs, fostering engagement and meaningful progress. In conclusion, while the intent to ensure effective treatment is valid, forcing participation disregards clients' autonomy, may increase resistance, and hinder true independence. We must balance respecting clients' rights with supporting their growth and well being.
Clients should be able to choose to participate in treatment and throughout treatment. Clinicians can modify treatment plans according to assent and assent withdrawal indicators from the client throughout treatment. Brooks and Smith describe assent-based intervention as a phrase used to describe a way of delivering services that emphasize and actively seeks to obtain learner assent. In assent-based intervention, both assent and assent withdrawal are individually defined for the learner, continuously evaluated, and responded to during intervention between the interventionists, such as the BCBA, therapist, teacher, or parent. As part of the delivery of intervention, the learner is provided with opportunities to provide and withdraw their assent, and teaching of related choice-making behavior is prioritized. In addition, by increasing engagement and rapport with the client, this may also increase the likelihood of the client's desire to participate in treatment. Furthermore, Ethics Code 2.09 requires clinicians to involve clients and stakeholders in treatment services, such as but not limited to setting meaningful goals, which may increase the likelihood of the client wanting to engage in treatment or treatment of their own accord. The clinician should also take into consideration the social and external validity of goals being targeted and skills being taught. Clinicians can program for appropriate replacement behaviors while slowly working up to toleration skills so clients can request to escape functionally. If problem behavior occurs, the clinician can form an intervention plan to teach replacement skills to functionally request a withdrawal from participating. This method limits the harm to the client and teaches a valuable long-term skill at the same time. In addition, when there is lack of autonomy available to the client, this often leads to an increase in problem behaviors. By offering a level of autonomy to the client, it can result in an increase in desired behaviors. The process of prompt fading and prompt delay can also be incorporated throughout services and helps to promote independence. Brooks and Smith describe that assent is a human right that is afforded to those deemed competent by the culture and society they inhabit. In other words, individuals with intellectual and developmental disabilities may be assumed to be incapable of providing and withdrawing assent. However, the human rights model of disability asserts that individuals with disabilities have the same fundamental rights and freedom as everyone else, including the right to choose, and disability should not be used as an excuse to deny a person's access to their rights or freedoms. The general principles of the United Nations Conventions on the Rights of Persons with Disability, or also known as CRPD, include respect for inherent dignity, individual autonomy, including the freedom to make one's own choices, and independence of persons, and full and effective participation and inclusion in society. Lastly, one of the four core principles behavior analysts treat others with compassion, dignity, and respect, and actively promote clients' self determination to the best of their abilities, particularly when providing services to a vulnerable population. If clients we serve are resisting engagement and learning of a replacement behavior or skill, for instance, clinicians have a responsibility to find a way for that client to want to participate with us by examples such as enriching their environment, pairing themselves with reinforcement, and various other steps so our clients continue to choose to engage in treatment with us. This visual displays the number of people with a disability state by state in 2021 as noted by the census. As of 2021, there was not a single state with under 11% of the population being diagnosed with a disability. We should ask ourselves how we are affecting society when not considering personal liberties and client autonomy within treatment.
Rose Stater.
As we conclude our discussion, let us reaffirm the importance of autonomy and dignity in treatment practices. Mandatory participation undermines these fundamental principles, potentially leading to resistance and resentment among clients. Ethically, we are guided by the principle of do no harm, which emphasizes respect for client autonomy. Safety, too, must be assessed on a case by case basis, avoiding broad generalizations. True independence emerges from empowering individuals to make their own choices. Our public resources should be used to honor clients' rights rather than enforcing participation. Lastly, individualized treatment plans are crucial. By tailoring therapy to meet client preferences, we foster greater engagement and progress. This balance between respecting rights and supporting growth is essential for effective and compassionate care. Thank you.
So as stated, effective treatment is important, and forced cooperation does not equal um, greater resistance. However, cooperation in less desired treatment, you can teach, your learners how to ask for breaks. And when you're teaching them how to ask for breaks, they're learning how to use their autonomy. And the worst case scenario must always be considered, because our client safety is obviously our top priority, and our staff safety. Without staff, we can't teach our learners. And client choice in treatment participation, it allows for so many issues. Client resistance may lead to discharge. Unfavorable client choice can turn into problem behavior. And I think a huge thing too is the federal support that's available for our learners, as they grow. And I know for a lot of the learners that I have now, once they age out of our program, there is so much financial resources available for them, to be placed in residential programs and that kind of thing. And that's because of their involvement in treatment. Um, so in conclusion, as behavior analysts, we all have a common goal: independence for our clients. And I think the biggest point of contention will be that if clients have the right to choose to participate in their treatment or not. While personal autonomy and empowerment is important in every citizen's life, it's also imperative to consider the ethical implications in ABA. Our population of clients has the potential to engage in serious high risk behavior, that we agreed to help modify to promote a better life for them and everybody involved, parents, staff, everybody. And I think that all of us can agree that we want to encourage our clients to learn, develop skills, and adapt to their environments at little to no cost. So as Bannerman's article states, all people have the right to eat too many donuts and take a nap, but at what cost? And these are just some potential questions that our audience may have while listening to our presentation. So someone might be thinking, how can a behavior analyst force someone to participate in treatment? Um, so speaking from the con side, I wouldn't really consider it forcing someone to participate. Not allowing someone to decide if they have a choice in treatment can help teach a client to learn to appropriately ask for breaks during treatment sessions. So they're still participating, but learning, okay, how can I tell my teacher that I need a break? And it allows the client to minimize the risk of harm with staff members involved when they're able to say, hey, I've had enough right now. I need a few minutes to, go engage in a task that I want. I know for my clients that I have right now, when as soon as they're able to individually, independently ask for breaks, we are able to get more done in a session. Even if that means breaks are more frequent, we're still getting more done because they're able to decide when we're going on a break. Um, and it minimizes the risk of harm with staff members involved in their lives, as well as teach stakeholders and parents how to effectively have your kids and students participate in treatment.
Okay, so another question that could be possibly asked is, how can individual freedom promote quality of life? It actually allows clients to be incorporated into their treatment decisions versus making them feel like they're following a set of questions that they did not have a choice in. Most people enjoy having a sense of control in their life and what they learn, and that should not be limited to people with autism spectrum disorder.
And a final question someone might have is, should personal liberty apply to all clients or only some? So in general, person-centered planning should apply to all clients. They should be the main priority and focus of treatment, regardless if they can choose or not. So even similar to, as I was saying before, it depends on your learner if you can teach them to ask for breaks. Obviously, some kids are going to ask for breaks every, 30 seconds if you give them the choice to. So it's all about finding that balance in breaks and treatment and when to allow that. And these are our references. Okay, thank you for listening to our debate.